Another common one, I've got arthritis. Do you? What is arthritis? Arthritis commonly, well there's two major varieties, osteoarthritis, rheumatoid arthritis. Osteoarthritis is just a general degeneration of a joint, and we'll talk about that more in a minute. Rheumatoid arthritis, rheum, there's a blood factor. And the blood factor normally means that there's an irritation, so there's swelling involved with that. The rheumatoid is a little bit harder. I'll just talk very, very briefly about that at the moment. Rheumatoid arthritis, massage can help, but you're a little bit like on eggshells. We really need to be very, very careful with how we work with you, what sort of depth that we work with you on, and what cycle of inflammation. Anyone with really chronic rheumatoid arthritis, they'll have different cycles where it will get really bad and where it might ease off. If you're in a really bad stage, a massage may help it or it may irritate it. We're all slightly different, so it's trying to work out and always going on the premise that we work very gently initially and then slowly load up. It's an overload principle. If we do this, if there is any negative reaction, the reaction will be minimal than if we went in very deep. And most people's problem when they're working with people, they don't understand that we can start off light and progressively work in. The overload principle. Let's go back to osteoarthritis, because that's the one that massage can have a big impact on. A lot of people get told that they have it, and quite frankly, you know, if you've got a label, most people, you're comfortable with that because you know what's wrong with you. Why not do something about it? Why not look at trying to, if you can, and what I'm suggesting is that, you know, muscles, hey, every muscle crosses at least one joint. Now, if the muscles crossing the joint are 5 or 10 times tighter than they could, or indeed should be, that's 5 to 10 times the load through the joint. Has to be, doesn't it? Increased, which puts increased pressure through the joint. Increased pressure is increased friction. You know, it's going to bind it in. It's not good for it. Increased pressure is equal to increased wear. Increased wear of the joint is degeneration. Degeneration of the joint is commonly called arthritis, you know. So if you have it, there's something that you could do. Look at massage, look at stretching, look at yoga. You know, there's a myriad of things that you could do. Look at Tai Chi, you know, maybe even just a gentle walk. At times doing a little bit of very gentle and very light exercise, there's the old adage, use it or lose it. If you're not using it, you will lose it. If you lose muscle tone, that doesn't help. And it makes a lot of other things a lot harder, and a lot of other muscles then have to compensate because you don't have the strength possibly as much to stabilize yourself and to have general action. So if you're in doubt, please see someone. You know, first route of call at all times, see your doctor, see what they think, you know, and if there's no pathology there, make your own mind up. You know, try yoga, try massage, try something. Do yourself a favor. You know, extra load through the joint, extra degeneration. At the end of the day, if it degenerates too much, what are you going to end up with? Worst case scenario, hip replacement, knee replacement, you know, some replacement. Is that good for you? Of course it's not. You know, our new bits versus replacement bits, our own bits versus replacement bits. One can last a lifetime if we look after them. The others don't last as long. So, you know, I don't know about you, but I want to keep my own stuff. I don't want to have anything replaced unless it is absolutely necessary. If I have an accident and something gets chopped off, hey, great. Well, it's not actually great, but I would look at getting some sort of a device to help me to move around. But apart from that, I want to keep what I have, and it's up to me personally to look after it. And if I don't, then you know, when we're young, we get into this adage where we're Superman or we're like a superhero in the sense that we're invincible. As we get older, you get to 30, 40 or 50, depending on who you are and depending on your lifestyle, you'll understand that, hey, we're mortal, we are mere mortal. And that's when normally people start to look after themselves a bit more. And just explore your options. Google stuff, look at stuff, Google it, and yeah, see what you can do. But obviously, you Google stuff, you could get a couple of million responses on something. You'll also have to bring your mind to the job as well to be able to filter the information and what feels right, what feels true for you, and go with the flow. We're all different, and we all need slightly different stimulation and different ways to have a good rehab. Thank you.